I'm Dr. Phub. I'm practicing as a Head and Neck Onco-surgeon in Bhutan, and I work at the National Referral Hospital in Thimphu, the capital of Bhutan. Buddhism is compassion, and because whether we deal with a patient or whether we deal with any other individual apart from ourselves, I think understanding that person in entirety, it's very important. And sometimes when we are in a very busy, tight schedule, sometimes we might overlook that. We might overlook the human part of interaction. We might, as a doctor, we end up sometimes being more technically oriented, and we forget that human touch. In Bhutan, because we have a culture which is quite strongly influenced by Buddhistic values, and compassion being number one. So right from our childhood, we were exposed to those kind of thoughts, like you have to be compassionate to some other fellow being in order for you to understand him properly, and then maybe develop a relationship which is based purely on compassion and being able to help somebody. Because apart from compassion, another very important aspect of Buddhism is we gain satisfaction when we are able to, even if you are being able to be of little help to somebody, it may not be a significant help, but even if you could help that person in a smaller ways, that derives a lot of satisfaction. And in Buddhism, those principles are well pronounced. And because we are exposed to those kind of cultural influences right from the childhood, I think there is an advantage with these kind of influences because even I think there is some kind of influence even in our subconscious mind when we were exposed right from childhood to those kind of values. So that actually helps us quite well when we interact with our patients and actually helps us in a very positive way. I think the main difference between the perception about cancer in our part of the world, and especially in my country and like the other countries that I've visited, is mainly to do with the perception of the term cancer itself. In my country, like still especially in the rural areas, when they say cancer, it is like some kind of a death sentence. So, and also people have a lot of cultural belief that if you are a cancer patient, then definitely like it's some kind of bad karma where you haven't done well, because we have the strong Buddhistic influence in our culture, and so we believe that because of your bad karma or some kind of things which you have not done in your previous life, now you have to suffer as a cancer patient. So cancer is a myth, still a myth in my country, where people don't accept easily. So people rather choose not to label themselves as a cancer patient when we diagnose a cancer patient. They would rather hide themselves, especially in the villages. Once they're diagnosed with cancer, like it becomes quite secretive in a family. Even to share among the neighbors, they would rather say I am suffering from some XY disease rather than saying that I'm a cancer patient. So those kind of cultural differences I found between my country and the countries that I've been exposed to. And also in my country, like because of the inability of the family or the patient to accept a diagnosis of cancer, most of the time they would like to say, even among the family, say supposing I have diagnosed a patient with cancer, and the relatives don't want the patient to know. That is something very disturbing, because cancer is such a major disease which would need extensive treatment, and since we are going to treat the patient should be in a right psychological framework to accept the challenges and also to go through all the difficulties in order for him to have some form of treatment. And in my context, as I've already explained, the relatives or the family, they would rather prefer hiding the diagnosis from the patient itself. So those are some of the differences that I have found in the way how people perceive cancer. one interesting thing about, as I've already discussed about the Buddhistic influence in our culture, main thing I think lies in the way how we communicate with the patient. So once you have explained properly, and once you have brought the patient in the right framework of mind, then slowly they tend to accept that now, even if it is the end of life, they gradually come in terms with reality. And then even if we cannot actually give a cure, then ultimately I think people are more prepared to accept the eventuality. It's a day-to-day, challenge on a continuous basis, because on one hand, you have to deal with the technical part of doing a complex surgery like head and neck surgery. On the other hand, you have to treat the patient as a whole. You have to understand the patient's emotional aspect. You have to understand the patient's background, educational level. So a lot of psychological complexities that we have to deal with apart from the technical aspect of surgery. So combine these two, and then treating the patient as a whole is quite challenging. And because of the challenge that is involved on a day-to-day basis, I find it very interesting, because every day is a challenge. Whenever you make a diagnosis, the moment you explain the diagnosis to the patient, you are not sure how the patient will react. You're not sure how the patient will respond to the treatment. You're not sure in so many there are so many uncertainties right from the diagnosis of patient. Diagnosis of the cancer. So that itself is very intriguing and as well as quite challenging, and because you get that opportunity to deal with a challenging situation on a day-to-day basis, I find it very interesting. I think it do take a toll on the practicing clinician as well, because no matter even if you say that you're quite strong, you're emotionally balanced yourself, after all, you're also a human being, especially in young patients where you might he or she end up losing life in front of your eyes after the treatment fails to work on him. That particular time sometimes is quite stressful, and because of that, I feel that you really need to take good care of yourself, not only about the patient, but I think in the long term, any clinician who is in oncology should have some kind of some kind of system where he is able to take care of himself, so that, because first of all, if you are not balanced yourself, then it's very unlikely that you will be able to offer proper help to the person who really needs that help at that point of time. So I think we should, as a clinician, we should also take care of ourselves before we actually could take good care of our patients. So I do end up doing general, at least 50% of my work is general ENT. So that makes me actually quite very busy, and I have a real shortage of time. So whenever I could manage time, but I do make a point that at least I keep physically fit. So I try to walk in the morning, or maybe in the evening I try to attend gym. And whenever I get time, I try to interact. Apart from the medical stuff, I go out, I interact with friends, I visit families. So I think, and on a very luckier side, in Bhutan, we have quite a laid-back kind of a culture. So in cities, big cities where life is in such a haste, in Bhutan it is quite relaxed. It may not be totally right to say that we are the happiest country, because we do have our own challenges, but on a very positive note, our people are quite satisfied. And I think one of the main reasons why we are labeled as the happiest country is mainly because right now we have two basic things are well taken care of by the government. So that is really removes that major stress out of any family's life. We have totally free education, totally taken care of by the government. It totally depends on how much you perform. If you perform well, then even up to PhD level, whatever higher level you can go, it's totally supported by the government. That is one thing. And the second thing, we have free healthcare service. So in Bhutan, the insurance company is the government itself. So even if you want to have a kidney transplant done, it is freely support. I mean, it's totally. We don't do it in our country. We do send the kidney transplant patients to India, but it's totally funded by the government. Not only the treatment cost, but even the cost of the journey, including the stay of the patient. The government arranges a guest house for the patients to stay. They are paid daily allowance by the government. Not only the patient, but also the person who accompanies the patient is paid by the government. A daily allowance is given for them. So I think when health and education is taken care of by the government, people can actually relax and have other ways of enjoying life. I think that is one of the main reasons why. Personally, that's what I feel. And then, of course, we have that, as I've already mentioned, we have that strong culture which is influenced by Buddhistic values. People, like, if they have something to eat today, and even if they don't have anything to eat tomorrow, I think they could carry on with life, and they're quite happy and satisfied. I think that makes it quite beautiful.